Now to a health alert about malaria cases in Florida. For the first time in 2 decades, U.S. health officials identified 5 cases of this deadly disease. 4 of those 5 cases were here in Florida, the other one in Texas. Tarek Miner's here after speaking with local health officials about their efforts to alert the public. Tarek?
And here's what we know about those 4 cases in Florida. 4 of them are in Southwest Florida, Sarasota County specifically. A medical expert says that the urgency behind this public health alert is because scientists are 100% sure that the malaria disease did not come from overseas. Malaria is most commonly spread when an infected person is bitten by a mosquito, where a small amount of blood is taken containing microscopic malaria parasites. And within 1 week, the malaria parasites mix with the mosquito's saliva, which is passed along to the next person the bug bites. CDC officials say Americans typically contract malaria while traveling to other countries, saying this recent small outbreak is highly unusual because it originated in the U.S.
What this health alert is stating is that we now have what's called endemic malaria here in Florida. That means they found 4 malaria cases in people who have not had foreign travel, meaning they picked up malaria from a mosquito in the state of Florida.
Chad Nielsen, who's the director of accreditation and infection prevention at UF Health, says scientists haven't seen an endemic case of malaria since 2003, when 8 cases of malaria were reported in Palm Beach County. He says because there is no vaccine or no protection for being infected, CDC officials are aggressively trying to find the disease's origin.
When we have a cluster of cases, so that means more than 1 case in a certain area, they're going to be searching for the source of those mosquitoes. So they're going to be looking at ponds, they're going to be looking at standing water, reservoirs off the side of the road, water ditches.
Nielsen says malaria is usually found in warmer regions around the world in tropical and subtropical countries, where the higher temperatures allow the disease to thrive. Symptoms of malaria include aches, pains, fatigue, shivering, sweating, chills, nausea and vomiting, and even high blood pressure. And unlike other diseases, there is no specific demographic that might be more at risk.
Most people are going to be at risk for malaria if they've never had it before, right? So malaria has largely been a forgotten disease here, at least in the United States. But for other parts of the world, Africa, South America, it is still very much a real thing and the leading killer of people.
Before the COVID-19 pandemic, about 2,000 cases of malaria were reported each year in the U.S., nearly all of them in people who acquired the disease abroad.
Any county in Florida that has a lot of water, which is more or less all of us, you could be at risk for malaria.
So if you've lived in Florida for a while, you know how to limit the amount of mosquitoes around your house. If you haven't lived here for a while, here's what you do. Eliminate any of that standing water you have around your house in a bucket or anything by pouring it out. Wear bug repellent when you go outside. And with our temperatures on the rise, doctors say it is more important ever than now to heed this advice through the rest of the summertime.